Hey guys, welcome to the Gray Farm YouTube channel.
Hello.
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 Figured I would talk Medkits. One of the comments on the last video, a guy was talking about using tampons to plug holes, and I just felt like we kind of needed to talk about that a little bit. So tampon guy, thank you for commenting on the last video. Send me your address and I will send you some hemostatic gauze, my dude. So this is going to be personal medical kits for carrying on a plate carrier or belt setup. This is going to be pertaining primarily to gunshot wounds, high trauma, stuff like that. This is going to be, these kits are going to be dedicated towards that type of environment. You can't keep everything you want with you all the time. You can't have like a hospital on your back. So basically we carry these to get the job done until you can get yourself or them or whoever to a real hospital to save their life. That being said, we are going to focus on the TCCC. All right, I'm just going to read exactly what my buddy sent me about this. He's a PJ, so I had him write up a little thing on Medkits just so that you have a subject matter expert. So when following the typical TCCC guidelines, the items in the Medkit have been proven to aid injury that, if left untreated, leads to the greatest mortality. So the first thing he says in a personal Medkit that you need, I'm going to go ahead and outline the contents of a personal Medkit right here. I had him draw it up for me. The two things in the very bottom are specific things that he carries, just being that he is a PJ. I wouldn't worry about it, especially the Cric kit. If you don't have proper training on that, you're going to do a lot more damage than good. So yeah, tourniquet. Have a tourniquet somewhere on your belt. I need to go ahead and get another tourniquet holder for this one. This one I just built out the other day. Yeah, tourniquet. The rules for the tourniquet are high and tight. That's what you want. If, say, you have a bullet wound in a junction, like somewhere in the shoulder or in the inside of the hip or something like that, that's where the hemostatic gauze comes into play. Just go ahead and take that. You can throw the roll over your shoulder and pack it. There's a special way to pack it. You should probably just take a med class on it, to be completely honest with you. But it's got a hemostatic clotting agent inside of there that's going to help stop that bleeding and get you to survive to the next location. People have stopped using Quick Clot. Back in the day, Quick Clot was the kind of cool thing to use. If you dump it into a wound and then you pack the wound on top of it, or you pack the wound and then dump Quick Clot in there, it turns into almost a concrete. And so when they're pulling the gauze out, it's going to do more damage than original. If it's all you have, I would just suggest getting some hemostatic gauze. Just replace it. The hemostatic gauze is kind of expensive, but it's definitely worthwhile to have with you and on you. For use high and tight on the limb of massive hemorrhage when assisting in injury in combat, being able to quickly ID massive hemorrhage and treat is key. That is what the hemostatic gauze is for. If you can't put a tourniquet high enough on the limb, you need to put the gauze in the wound. It needs to be held under pressure for 5 minutes. So make sure you have cover whenever putting this on. You don't want to be in the middle of a firefight, in the middle of a room, trying to hold this guy down. It's kind of like if you guys play video games, it's like trying to revive your buddy on like Apex or whatever. Like, it takes a certain amount of time. So make sure if there's a dude in the room, you kill him first and then go revive your buddy. So. All right, and then we have the nasal pharyngeal airway, also known as an NPA. That's the little green tube that you shove up your nose. That is to keep the airway open if you are unconscious. It is not for folks that are awake, and if they are awake, they're going to let you know quickly that they don't want that. The chest seal is for any wounds that could be affecting the lungs. Many bullet holes are small, so don't be afraid to cut it down. I have a couple different chest seals. This is one of like the massive halo dressings. And then these are some of the compact, like hyphen chest seals. So these ones are a lot smaller, but that being said, like he was saying, don't be afraid to cut these up. The entry and exit wound is going to be really small. You don't need that massive thing over the whole thing. The dart, which is the emergency needle decompression, it is only for if you have confirmed injuries to the lungs that is causing a pneumothorax. He put in parentheses, learn how to do this by a trained professional. This can kill as easy as it can save. If you quick bare bones on needle decompression. Basically, you have a little line in the front of your chest that's called the angle of Louis. There's a bone that runs across your shoulder that is known as your mid-clavicular line. You want to go right in the middle of that, and then basically 2 down is your second intercostal space. That is where they used to do needle decompressions, but being that, you know, usually guys, 1, in the military, they're going to have huge pecs, and then 2, they're going to have body armor on top of that. So they've started to go to the 5th intercostal space, which is up underneath your armpit. You basically take the patient's arm and you put it under here like that. And then usually around the pinky, just inside low is your best bet to safely do it. But again, if it is not something that you're trained to do, don't do it, because you could cause a lot more damage. The way you're going to be able to tell a pneumothorax is basically what's going to happen is you got to think about like a balloon or something inside of your body, and your lung is the balloon. When that balloon gets punctured, it's going to release like fluid and stuff into your body. That fluid is going to start to put pressure on the rest of your chest. So say you have a patient that's down, he's conscious, he's breathing, you put a chest seal on him, you know, you stop all the bleeding, you put him over in the corner, and you're doing something else, and you realize, oh man, he's now non-responsive, he's starting to pass out. You notice there's a lot of like swelling up in here. Basically he is bleeding out internally, and he needs that emergency needle decompression so that he can clear that airway so he can breathe again, and get him to the hospital, because it needs to happen very soon. So yeah, that being said, you might need to do multiple needle decompressions, and you can also tell that if it's done correctly, when you put your finger on the back of that needle, you will feel air coming out of it. But again, this is just bare bones, just in case you absolutely had to do it. Take a med class, take a med class, take a med class. All right, the rest can be used for any wound. There are best practices on how to apply medical devices for different types of injuries, but that is geared to have to save your life or a buddy's life in the battlefield. Also mention training and learn how to use each device so that the first time you pull these devices out, it's not in the heat of battle or whatever. Make sure that you train this stuff, practice with it, and know how to use it. He also said, like with these med kits, for example, this is a focus research group one. These can go behind your plate carrier bags. He said that basically just all of these are different. So if you're going to buy one, buy 2 and train with the other one. These are pretty expensive. I think these are like $250 a piece, but at the end of the day, what is your life worth? If you're dying, bleeding out, you're going to wish you spent $250 when you're going to lose everything. So yeah, let's see what else we got. All right, so on the Medkit pouches, like these ones are good because they're like an all-encompassing set. It's got the gauze in it, it's got chest shield, it's got an eye shield, it's got the needle D, it's got a Sharpie, it's got all of the information to write where the injuries and stuff are, so when you pass them off to somebody else. This is great option for the plate carrier. I'm going to show you another option. This is a belt mounted system, and again there is also the SOP for this guy's unit is to carry 2 tourniquets on you as well. So I go ahead and do the exact same thing. So here is a belt mounted med kit. This one is in I think this is a Blue Force Gear pouch. It's either Blue Force Gear or LBT, but this is basically just vacuum sealed personal med kit. So the main point with the personal med kit is that it is going to be used on you as opposed to others. Keep that in mind. That's why, everyone should have their own. If you keep one of the ones in your chest, you can throw that to somebody if, they don't have med for some reason. But this is primarily to be used on yourself. So this one just has a really big chest seal in it. It's got a tourniquet. It's got a pressure dressing. It has a combat pill pack in it, which is kind of cool. Yep, and then just more gauze and dressings in there. And then it's vacuum sealed down, so it's nice and tight. And it can go, right into this pouch and be deployed on yourself. Counting Coop Tactical, Fred, basically from there, he takes a retention lanyard, like one of the bungee ones, and lanyards this to his kit so that if someone pulls this kit out and they start working on him and he needs to be drugged to a different position, this will then be attached to him and come with him. Just some more food for thought. I don't have that done right now, but you can get some of these scissor leashes from North American Rescue, and you could literally just take this, hook it to your kit, hook it on there, and then it'll never leave you. It's also a good idea to use those for your trauma shears, because something a lot of people don't think about when they think of this whole, preparation medical situation is that a lot of the times you're not going to be able to exactly tell where the person shot. It's not going to be like a big gaping hole like you think of in the movies. That's why it's important that if you think that someone might have sustained injury to the leg, cut the pants off, look, check, make sure that you've, really done your due diligence to make sure you've identified all the wounds. Because if someone's shot and they're going through massive trauma, they're not always going to be able to identify it. There was a police shooting that I saw just the other day on a video, and the guy ended up bleeding out because they thought he was okay, and he started just acting weird, and they thought it was adrenaline dump going off, but in reality, he had a wound to the inside of his stomach, and he was bleeding out internally. So that being said, cut the clothes off, check, make sure, if you don't have a buddy, go through every limb. Don't just assume that you're fine, because in combat situations, adrenaline, stuff like that, stuff gets crazy. Another thing that you don't really think about, this is an emergency blanket. Basically helps you get warm. You got to think if you're like, if I'm in a gunfight, I'm gonna be hot. Not necessarily. If you get shot, you're gonna lose a lot of blood, and that losing blood can make you go hypothermic very quickly. So it's a good idea to keep a kind of like a one of these thermal blankets in you with your kit. Basically every single person's med kit that I've seen has had one of these in it, just because if you do get shot, you can get cold really fast and become hypothermic, which can cause another series of issues. All right, what else do we got? This is the Chito Gauze Pro. I just want to show you what this is. This is a type of hemostatic gauze. I'll show you another type. These are the small chest seals. They make trainer ones of these that are less sticky too, if you want to practice on your buddies. I'd always suggest, running through maybe once a month, go through your stuff and, any old expired med stuff, because you want to keep everything current. Just use some of your retired stuff and, use some of your expired stuff and go run it on some of your buddies and just practice, get acquainted with everything. These are some of the small hemostatic gauze packs. They're as small as they can possibly be. You rip them open. They've got a little tab right here. You rip them open. Like I said, you can throw the rest of the roll over your shoulder so that when you start packing, it'll just keep coming and coming and coming and coming. If you're tall enough, it won't touch the ground. If it does touch the ground, try to cut that last little bit off. Don't pack a bunch of like dirty, nasty dirt into his wound, your buddy's wound, or your girlfriend's wound, or whoever it may be, the old lady that was trying to cross the street that got smoked by a semi-truck, I think that's about it. This is only stuff that is meant to be used to get you to another position. So what did we learn today? Your personal med kit is to be used on you, not others. Keep 2 tourniquets on you at a time. Keep a pair of scissors on you. And also practice with this stuff. Learn how to use it. Learn how it's going to work in a non-permissive environment, in an austere environment. Try to put a chest seal on in the back of a truck as you're driving down a dirt road. It makes things a lot harder. Then add night vision into the thing. See if you can put a chest seal on in nods in the back of a truck. Just keep training, because this stuff, when you do need it, it's not going to be the best situation, and you can't always prepare for every situation. So just try stuff out, do stuff, see how it works for you. Yep, so big thanks to my buddy for giving me this information. It's kind of somewhat guarded. They don't really like to throw it out too much, but he was willing to give that to me, so shout out to him for that. He is going to he's basically transitioning out of the military, so after that he's going to come on the channel and talk about some stuff. So you're stuck with me for the time being, but just know that you have some subject matter experts coming on med. So yep, I think that's about it, guys. Thanks for watching. Peace.